Parkinson's disease is a lifelong condition, but physical therapy can improve many of the symptoms. Let's meet one of the physical therapists at Faith Regional who helps with Parkinson's patients. I'm joined now by Ky'Lee Baumert, a physical therapist with Faith Regional Health Services. Ky'Lee, one of your specialties is dealing with patients that have Parkinson's disease. When you approach that from a physical therapy standpoint, what does it look like?
Well, I am trained in LSVT BIG, so it's a very strict protocol that is 4 days a week for 4 weeks. We focus a lot on their amplitude of movement. So the research has shown that when we focus on their amplitude, a lot of the other issues that are seen with Parkinson's kind of fall into place. So analogy that I saw a while back was what the brain does to an individual with Parkinson's is it slows down your movement and it makes you feel like you're moving normally when actually you're not. So we recalibrate their body and we show them move like I'm moving, which seems like it's very exaggerated and huge and kind of obnoxious sometimes, but then it lands them at that normal movement pattern.
What are some of the exercises and practices you're doing with patients?
So the program is pretty specific to their exercises. So we go through them and we say, do as I'm doing. It's working on, big arms, big steps with walking. It addresses their motion of their shoulders and their back and their hips throughout all of the exercises. So we can modify the exercises depending on their needs. They have protocols for sitting, even laying down if they aren't able to get up and move as well. And then there are standard standing exercises that we can also adjust for balance with and arm support or whatever they need.
With a condition like Parkinson's, I'm sure many folks think they just have to deal with these issues, but there are outcomes where they can improve and those improvements can stay.
I always encourage people, it's a chronic neurological disease, yes, but these treatment protocols have been researched pretty heavily and have been shown that they can really slow down the progression of the disease, which is very exciting because the movement and the exercises is very crucial in Parkinson's.
Well, Ky'Lee, thanks so much for joining us.
Thank you for having me.